Developing a patient's motivation for change is central to the treatment that we provide in CAP. Motivation is built using some of the skills discussed already in the other modules, like developing an engaged relationship with the patient and working collaboratively with the patient. But there are also some other specific ideas and techniques which we will discuss in this presentation here. Most of the patients coming for treatment have ambivalent feelings about change. By ambivalence, we mean having strong feelings in opposing directions. For example, a patient with harmful drinking may realize that his drinking has started creating problems in his life and he should change. But at the same time, he may also have a strong desire to continue drinking. Helping a patient to resolve such opposing feelings is a very important step in developing his motivation to change. We will see that many patients come with different levels of motivation when they come to you for treatment. There will be the patients who have never seriously thought about changing his or her drinking behavior. In such patients, we need to see if we can help him or her make a decision on whether to change things. There will be patients who have been thinking about making a positive change in their drinking behavior, but at the same time have a strong feeling to continue drinking. Our job in this case is to help the patient to resolve the dilemma that they have in their head. Finally, you would have a patient who has already decided to either control or completely stop his or her drinking. In such patients, we should focus more on helping the patient to plan and implement change. We need to remember, whatever stage of motivation the patient is in, our key task is to 1. Help the patient to develop motivation for change, and 2. Work with them to bring that change in reality and maintain that change. Some of the essential skills for a counselor include identifying change talk within what a patient says and to encourage it, elicit change talk if the patient is not coming up with it spontaneously, and identify sustained talk within what a patient says and work at discouraging it or ignoring it. It helps patients to change their behavior if they hear themselves stating that they want to do this. If we can encourage the patient to make change statements or to generate change talk, it is more likely that they will go on to change. Often, a patient will spontaneously come up with change talk early in the course of our first session. This slide shows a list of some ways in which change talk is often expressed by a patient during counseling sessions. Once a patient makes change talk, we need to be able to encourage the change talk. This simply means giving the patient affirmations by saying very good or excellent, or it's really nice to know that you want to stop or change your drinking. There are times when patients do not come up with change talk on their own. In such situations, we need to try to elicit change talk from patients. There are several ways to do this. One is to ask them directly via open ended questions. Another technique is to first ask the patient to describe the good things about their drinking. You then ask them to tell us about the less good things about continuing to drink in the way that they're currently doing. Finally, you then ask the patient to compare these two situations. This often helps the patient to clarify whether the advantages of changing outweigh the advantages of continuing to drink as he is currently doing. Another way of making the patient come up with change talk is ask them to look forward to a time in the future and to tell us how the patient sees the future, what would the patient like the future to look. Once you start eliciting change talk, we can simply keep it going by using a few other skills like asking for more details, commenting positively on the patient's statements, reflecting, and summarizing. What is sustained talk? Patient statements which argue against any change in drinking behavior are called sustained talk. The more those patients hear themselves say that they don't want to change, the less likely it is that they will want to change. So we need to discourage our patients from speaking positively about staying as they are, or from showing an interest in continuing to drink harmfully or problematically by carefully moving the discussion on. There are several ways in which a patient can express sustained talk. They could interrupt you while you're talking, they could argue or challenge you, or sometimes be openly hostile. They could change the subject or not respond to your questions. Finally, they could minimize or deny the problem that they are having, or give excuses for their own behavior, blame others, or reject your opinions. Some examples of sustained talk are given in this slide. What do we do if we hear sustained talk? One strategy is simply to reflect back to the patient what he or she is saying. This sometimes has the effect of eliciting the opposite and balancing the picture. Another way is to exaggerate what the patient is saying to the point where the patient is likely to reject this view. Another strategy is to diffuse sustained talk by shifting attention away from the problematic issue by changing the subject. This strategy can be particularly useful with patients who seem to reject every idea or suggestion. In no circumstance should we get into an argument with the patient to convince him or her that she is wrong. There are certain things that we might do in counseling which seem to push patients into responding with more sustained talk, and therefore we must avoid doing these things. These include assuming the role of an expert or being bossy, criticizing and blaming the patient for their condition, provoking guilt and anxiety to try to make them change, and telling the patient not to talk but just to listen to us as the counselor.